Hi, this is Bedrest Coach Darline Turner-Lee, owner and founder of Mamas on Bedrest and Beyond. Today we're talking about exercise during pregnancy. And it always amazes me. It seems like topics come up and they kind of go in a cycle. A couple weeks ago we were talking about returning to work after having baby and working options with your baby. And in the last several blog posts and video blog posts, we're talking about exercise during pregnancy. Now, a lot of mamas on bed rest are probably thinking this has absolutely nothing to do with me. And I have to say that's absolutely not true. But kind of what spurred me to do this video blog, because I want to share some information with you, is this article that I have just printed off of MedScape. And it's by Kathleen Doheny, and it's entitled Many Pregnant Women Fear Exercising. And I thought, well, that's really bizarre because, the literature and the data for some 10 going on 20 years now clearly states that exercising during pregnancy is beneficial. And yet, this just shows that we're really not getting that word out. This paper, it's kind of a presentation. It was presented at ACOG, the American Congress of Obstetricians and Gynecologists, which is having its annual meeting. And it's out in San Diego. So they're having their annual meeting, and this was one of the presentations. It was presented by, what is her name? Dr. Haig. And let me see if I can get her whole name. Her name is Melissa J. Haig, MD. She's a clinical professor of obstetrics and gynecology at the University of Kansas School of Medicine in Wichita. And what happened was, I guess she has been caring for lots of pregnant women, and obviously she's an OB, and has just been kind of looking at exercise rates amongst her patients, and is like, why are my patients not exercising? She and her staff did a kind of mini study, and they found that women are just afraid to exercise. They feel that if they exercise, it's going to in some way hurt their baby. It's really interesting because and I'm going to share a lot of it here. The experts are like, no, exercise is absolutely fine. It's great. It's wonderful. It's something you need to be doing while you're pregnant. And yet the word is not trickling down to the women. So this is what Dr. Haig had to say. She was curious as to why so many women don't exercise. So she and her team did a phone interview, brief study. They interviewed 90 women who were between 16 and 30 weeks pregnant. After becoming pregnant, about half of the women said that they exercise before becoming pregnant. Let me fix that. Before becoming pregnant, almost half of the women said they exercise moderately at least 90 minutes a week. After becoming pregnant, less than 27% continued. And the primary reason was they said they were afraid they were going to hurt the baby. Now, she thought this was interesting because of all the data in the literature. But what she found was safety concerns were more of an issue with those who weren't active. And she found about 62% of those who exercised during pregnancy thought working out longer than 30 minutes is safe, but only 18 of those who didn't exercise thought so. So if a woman was already sedentary, her mindset was, well, if I start exercising, I'm somehow going to hurt the baby. She also found there were ethnic differences, and that while nearly 89% of white women said brisk walking is safe during pregnancy, and 90% said that swimming is safe, only 60% of other ethnic groups thought brisk walking is safe, and only 67% swimming was safe. So this is really interesting. You're seeing a huge kind of dichotomy of people's perceptions. What she found also that was really interesting, I thought, was that myths passed down through family members was a huge indicator of whether or not a woman exercised. And I've seen this in terms of whether or not women breastfeed or use cloth diapers or any number of other issues. And what she found is if a mom tells a woman, you're going to hurt the baby, then they're absolutely not going to exercise. And I can talk to this from my own personal experience. I remember my mother-in-law just being beside herself when I was exercising early in my pregnancies. And both my mom and my mother-in-law were kind of surprised when I said, well, of course I'm going to nurse. Of course I'm going to breastfeed. And they were like, ew. because when they were having their babies in the early and mid 60s and late 50s for my mom, that breastfeeding had kind of become out of vogue, and the new thing was to give your babies formula. Well, we now know that that's different. That's not the case. Breast is best, etc. But for a lot of women, if their mothers say, ooh, you don't want to breastfeed, ooh, you don't want to exercise, ooh, you don't want to do this or that, they're not going to do it. So it's a huge indicator of what women are going to do based on what their family habits are. And what Haig also found is certain women are more likely to exercise during pregnancy, including those who believe they could manage it despite a busy schedule. Those who worked outside the home were more likely to fit in exercise during pregnancy. She also found that women who had higher education and higher income bracket jobs were more likely to exercise, which I think was kind of interesting. I don't know if that kind of correlates with level of knowledge, level of education, but there seems to be some correlation. So given what she found, she also, actually, I don't know if she did this, but this is what's in the paper. Given the findings of Dr. Haig, Dr. Raul Artal, who is chair and professor for obstetrics and gynecology and women's health at St. Louis University of Medicine, chimed in, and he is an expert on exercise during pregnancy. He reviewed the findings, and he had this to say. He notes that the Midwest, where he is experiencing an epidemic in obesity, and he feels, or he is kind of questioning, if this study, small as it was, and really just preliminary, were done in some place like New York or LA, would the findings be different? There are definite trends across this country. We know that the Southeast and parts of the Midwest have huge obesity epidemics and huge obesity trends going on. So of course, in these areas, we might expect that women who are pregnant are far less likely to go ahead and exercise. So this is what Dr. Artal, I hope I'm saying his name properly, had to say. And he raised a really interesting point, one that I found when I was having my kids back in the early 2000s, and one that started me looking at prenatal exercise, getting certified to do prenatal exercise, developing the Bedrest Fitness DVD, and on and on. He says doctors must take part of the blame for women not getting the exercise message. Physicians as a whole do not receive a lot of education about exercise physiology and behavior modification. This includes exercise and diet. There is still much ignorance about the fact that pregnancy should not be a state of confinement. And I think therein lies a huge piece of the puzzle. I can remember being in PA school. I went to Duke University, which is an excellent school. I got an excellent education. But in terms of behavioral modification, behavioral change, exercise physiology, diet, nutrition, we got virtually nothing. I think we got nothing. We got 1 or 2 lectures on behavior modification. I remember we did one morning from 8 a.m. to 12 a.m. on nutrition. One morning, that's all. And I mean, we know the scope of nutrition is huge. You can't possibly cover all there is to cover in nutrition from 8 to 12. And in terms of exercise, I can't remember getting anything. And I graduated in 1992. So the program may have changed. I mean, gosh, it's like 20 years now. But at that point in time, that was it. We got 4 hours of nutrition, a couple of lectures on behavioral medicine, nothing on exercise, and very little on behavioral change. I did some work in behavioral change when I worked at the Duke Diet and Fitness Center, but in terms of actual curriculum for PA students, medical students, there wasn't any. So here we are expecting these people to impart this wisdom when they don't have it to impart. So it's really interesting. Those are pretty much the highlights of that little mini piece. And as it says at the end of the article, these findings were presented at a medical conference. They should be considered preliminary as they've not yet undergone the peer review process in which outside experts scrutinize the data prior to publication in a medical journal. I mean, I think this is, I don't want to say it's anecdotal. I think Dr. Haig kind of noticed a trend in her practice, did a little quick and dirty study and probably will now go back and do something more in depth and really see kind of what's going on. But I think it really raises the question of what are the perceptions of exercise during pregnancy, and by all means, what are the perceptions during pregnancy of high-risk pregnant women, because across the board, women are like, I'm not doing anything. I'm on bed rest. I can't do anything. I'm not going to harm my baby. I'm not going to lose my baby. You know, we can go on and on. It is just almost anathema. And so we're going to talk about that a little bit right now. Now, when I was kind of putting things together, I had my daughter in 2002 and I had my son in 2006. And each time the pregnancies were high risk. And with my daughter, especially in 2002, it was a hot mess. But one of the things I did was I kept exercising, which about gave my OB a stroke. You know, she said, keep doing the things that you normally do. And initially things were okay. I think it was 16 or so weeks. I spotted a little bit, so I slowed down. And then around 20 weeks, we did the physiologic ultrasound and everything looked good. So I kept teaching for a while. And I remember I had my daughter in October. I think it was July. I happened to be in for a visit. And I mean, believe me, I had all kinds of this and that. And I happened to say to her, ooh, you know, feeling kind of some pulling in my belly. I think I better stop these doubles. And she was like, double what? And I said, oh, teaching double classes, where she almost fell off her stool. She was like, you're doing what? And I said, well, I teach, you know, aerobics classes. I teach step, and I forget what else I was teaching at the time, but I was teaching sometimes back to back if I subbed for someone. And she was like, you shouldn't be doing that. You shouldn't be exercising. And I was surprised. And I said, well, you said to do what I normally do. And she kind of looked at me and she said, well, I guess I should have asked what you normally do, because there were times if I subbed for people, I might have taught 3 classes a day. Now, I didn't do that while I was pregnant. But here I was, high risk, had had some spotting, had had some cramping or contractions or whatever, and, you know, had had surgery and all this other stuff. And I'm teaching step classes, and she was like, ah! And so it just really brings home the point that, one, when doctors say do what you normally do or modify what you normally do, you really need to be clear about what your patients are doing, because, like I said, I was teaching step classes. The other thing being, you know, is I think, and a lot of people will disagree with me, I think that is one of the things that sustained my pregnancy. I had so much nausea and vomiting with my daughter in 2002. I was sick all 9 months. It was not morning sickness. It was all day sickness. But for that hour or potentially 2 hours when I was exercising, I wasn't sick. I wasn't dizzy. I didn't hurt. I wasn't crampy. I mean, those were like the 2 hours of the day that I felt good. And, you know, I don't know. I don't know what to say. I don't know if that's a good thing. I don't know if it's a bad thing. I don't know if I should have stopped. Maybe she wouldn't have come early, even though she came at 36 weeks, 6 days. I was pretty far. And I mean, we can go on and on. You know, should I have been on bed rest? Probably at some point. We kind of missed the boat. Who knows? But I know for those hours that I exercised, I felt better. So what does the American Congress, or ACOG, American Congress of Obstetricians and Gynecologists, say about exercise? Their most recent guidelines came out in 2002, and to my knowledge, they haven't updated them since. And I'm not going to go through this whole thing. I have it printed out, but I'm going to kind of just give you the highlights. Epidemiologic data suggests that exercise may be beneficial in the primary prevention of gestational diabetes, particularly in morbidly obese women. And American Diabetes Association has endorsed exercise as a helpful adjunctive therapy for gestational diabetes when glycemic control is not achieved by diet alone. You know, we know that in obese people who aren't pregnant, that exercise is a good thing. We also know that for people who have high blood pressure, who have arthritic problems and conditions, the exercise is a good thing. So if women who have these same conditions become pregnant, we have to kind of assume, yeah, if she can exercise, and that's always the big if, you know, if things aren't so crazy that she can actually exercise, it's very likely to be beneficial to her. Now, when you're pregnant and considering exercise, of course, there are some things that you have to be concerned about. First and foremost, check with your doctor. I mean, when I was exercising initially, my doctor was like, okay, fine, great, groovy. When she heard about the double, she kind of cut me back, which was a good thing. But, for all intents and purposes, I was doing okay. And the baby was okay. And so there really was no reason to stop me until things got a little dicey near the end. And then we slowed down. But when you're thinking about exercise during pregnancy and when you're speaking with your physician about it, there are some what we call relative contraindications to aerobic exercise, and then there are some absolute. Now, when we're talking about the relative contraindications, we're talking about people who have severe anemia because you may not get good oxygen supply, unevaluated maternal cardiac arrhythmia, chronic bronchitis, poorly controlled type 1 diabetes, extreme morbid obesity, extreme underweight, history of extremely sedentary lifestyle, intrauterine growth restriction in this pregnancy, not others, but this particular one that the baby isn't growing well, poorly controlled hypertension, orthopedic limitations, poorly controlled seizure disorder, poorly controlled hyper, elevated thyroid, and a heavy smoker. Now, I'm a little concerned if you're a heavy smoker and you're pregnant, but anyway, that aside. So these are things that if you have them, it may not be the best thing for you to exercise. And if you do want to exercise, you need to get these issues under control. So you need to work with your physicians to get these conditions under control. And they are somewhat, reasonable, and you can work with them. Now, there are some things that you should absolutely not do if you are, let me start that again. There are some conditions with which you should absolutely not exercise during pregnancy. And those are if you have significant heart disease, restrictive lung disease, incompetent cervix, multiple gestation at risk for premature labor. So if you're doing if you've got triplets, aerobics may not be good for you. Persistent second or third trimester bleeding. Now, I talked about my bleeding. I was at about 16 weeks, so I was early second trimester. It did not persist, which is why I was able to continue. Placenta previa after 26 weeks of gestation. Not cool because, baby might be tap dancing on the placenta that's presenting first, and you could start bleeding and labor, and not a good thing. Premature labor during the current pregnancy. So if you've had episodes of preterm labor, you're out for exercise. No more for you. Ruptured membranes. So if your bag of waters is broken, no exercise for you.